Hello? If you have diabetes or if your family or friends have diabetes, this video is a must-watch. Do you think dialysis is something that only happens to other people? Actually, hidden risks might be approaching you or your loved ones. Understanding how to avoid the risk of dialysis for diabetes patients is the first step in protecting your health. In this video, we'll dive deep into the top 5 characteristics that are said to indicate high risk. Please watch until the end to protect the future of your family, friends, and yourself. If you like this video, please hit the subscribe button and give us a thumbs up. Now, let's get into the main content. Let's talk about the first of our top 5 characteristics that make diabetes patients more likely to need dialysis. First, did you know that poor blood sugar control dramatically increases the risk of needing dialysis? When high blood sugar continues for a long time in diabetes, it damages the kidney's glomeruli, eventually progressing to diabetic nephropathy. When you notice high blood sugar levels, are you aware that this could be the first step toward kidney damage? If left unchecked, your kidneys will increasingly cry out in distress. Proper blood sugar management can be difficult to achieve on your own, but early action can change your future. What will you do now to protect your kidneys? If you underestimate this risk, your body might suffer irreversible damage. Please be careful. Next, let's talk about the second of our top 5 characteristics that make diabetes patients more likely to need dialysis. If you have high blood pressure, you need to be careful. Did you know that high blood pressure puts an enormous strain on your kidneys? Hypertension is one of the major factors that damage kidney blood vessels and accelerate the decline in kidney function. As a result, the risk of progressing to unavoidable dialysis increases. Do you think slightly elevated blood pressure isn't a big deal? That could have serious effects on your kidneys later. Let's start managing blood pressure with small steps from today. By ignoring high blood pressure, your body is being exposed to serious risks without you knowing. It's not too late to start now. Next, let's talk about the third of our top 5 characteristics that make diabetes patients more likely to need dialysis. Those who have had diabetes for over 10 years need to be especially careful. The longer you have diabetes, the higher your risk of complications and the more susceptible your kidneys become to damage. During 15 or 20 years of living with diabetes, kidney function may decline without you noticing, increasing the likelihood of needing dialysis. Even if you haven't had major problems so far, that might just be luck. Now is the time to reassess your body. Don't neglect regular checkups and take good care of yourself. Just having diabetes for a long time means your kidneys might already be sending warning signals. Don't let your guard down. Let's talk about the fourth of our top 5 characteristics that make diabetes patients more likely to need dialysis. Do you realize how obesity increases the risk of diabetic nephropathy? Obesity not only increases insulin resistance, but also puts excessive strain on your kidneys. Weight gain raises blood pressure and reduces kidney function. This vicious cycle needs to be broken early. Try to be mindful of weight management in your daily life, even if just a little. Starting with small steps rather than big ones is key to protecting your future health. If you leave obesity unchecked, the day might come when you hear your kidneys crying out. Now is the time to take action. Next, let's talk about the fifth of our top 5 characteristics that make diabetes patients more likely to need dialysis. How aware are you that irregular eating habits, lack of exercise, smoking, and drinking can increase the risk of diabetic nephropathy? Daily choices accumulate and can eventually become factors that put pressure on your kidneys. Unhealthy habits can be improved starting today. You don't need to aim for perfection. Even gradually working toward a healthier lifestyle can reduce the burden on your kidneys. Are you putting off lifestyle changes? That small step can become the power to change your big future. Let's quickly review what we've covered. We explained the top 5 characteristics that make diabetes patients more likely to need dialysis. We discussed people with poor blood sugar control, those with high blood pressure, those who have had diabetes for a long time, those who are obese, and those with poor lifestyle habits. We explained in detail how each of these puts strain on the kidneys and increases the risk of needing dialysis. If any of these characteristics apply to you, please reconsider what you can do in your daily life. Even a small change in awareness might be a step toward major health improvements. Next, We'll share specific methods to reduce these risks. Looking back at today's content, we've identified characteristics that increase the risk of diabetic nephropathy and dialysis. Blood sugar control, blood pressure management, and lifestyle improvements are steps you can start right away. Let's think about what we can do starting today to protect your and your family's health. If even one of these applies to you, it might be a sign that you need to take action. Ignoring it could increase the risk of irreversible consequences. Please take that step to protect your precious body and future. If you found this video helpful or informative, please give us a thumbs up and subscribe to our channel.